as a primary care provider in this organization, I have felt those limitations of what we can achieve within the exam room. And it really takes an additional team being data-driven and proactive and reaching out in response to health events that data sources like Chris can tell us about, to really do more than what just a primary care provider and the people immediately working around us in the clinic day-to-day can achieve.
With this service, we see new patients and reestablished patients who have been out of care. This service is important because these individuals get in to see a provider sooner than most places, and they'll be able to see their provider within 1 or 2 weeks, depending on what their needs are.
Social determinants of health, different things going on in your life, access to food, access to transportation, financial restrictions, they have a direct impact on your ability to be compliant with your healthcare plan. So we have a lot of incredible providers, MAs, nurses at Brexton who are doing the most with their resources to help our patients, but sometimes you're running into these barriers that are not allowing the patients to move forward, and that's where care coordination comes in.
I manage a team of care navigators that connect patients with primary care providers after their discharge from the emergency room.
Help them navigate their new normal. And so we kind of follow up with them as well and help them keep in touch with their primary care doctor. And we also collaborate and communicate with their doctor to let them know that we did evaluate them so they are aware of what to do when they follow up with them in person or via telehealth.
I manage a process which involves anyone in the organization being able to request medical records that include specialty consult notes, cancer screening reports, and really just any medical record that's going to, assist with them being able to provide the best care to the patient.
The other part that I really enjoy of their annual wellness visit is when we take time to go over your cancer screenings and your preventive health tests that you may or may not have done. It provides a great opportunity for us to slow down, go over those tests that sometimes when you're having your traditional primary care visit, there's just not enough time for us to include all of those extra little things.
I get to sit at the intersection of healthcare data, business strategy, and patient care. I support our departmental and care transformation initiatives and our growing patient population with insights we glean from healthcare data.
With a population health team, I have to rely on their leadership to help me understand the causal relationship between the work that they do and how that influences the quality incentives that we receive for keeping our patients healthy. It's a partnership that allows us to pivot from not just tracking what happened, but to strategically invest in what's possible for our patients.
So we're very proud of having created a safety net within a safety net with our value-based care team and our care navigation and care coordination departments.
This department has really grown from when I started 4 years ago. We were participating in a handful of value-based care contracts with payers responsible for the lives primarily of about 1,500 of our straight Medicare clients through a program known as MDPCP, our signature care transformation program for the state. Last summer, I was so proud that we were able to become members of the first cohort of the AHEAD program, which is an expansion of MDPCP. We were among the first federally qualified health centers in the state to join this cohort, and that expanded the lives that we were responsible for from 1,500 to over 20,000. Our teams were prepared, we had our workflows designed, we used what we learned from MDPCP and applied forward and brought it to scale. We have also been able to work with other practices around the state to be able to share best practices and also the lessons that we've learned along the way to continue to drive success for the future.